Okay, sorry, I couldn't find my mic earlier. Okay. Case okay. Yang discussion ni, I'm just um a bit apprehensive. It's a little bit confusing actually. On the way you present. Kejap Satu is about the definition of the critical phase. You were saying something about sudden drop of fever leading to sudden drop of fever means patient is in critical phase. Uh, in a sense betul sebab selalunya critical phase masa effervescent phase, but it's not about the sudden drop of fever, faham I don't know, I've never put it that way. But sudden drop of platelet, yes, would put the patient at risk of critical dengue. Um, so that's one lah about the definition of critical phase. So critical phase can happen at any time. I have seen critical phase happening at febrile phase lagi. Tapi how would you know if somebody is in critical phase? Satu, kalau dia dah plasma leakage, if there's already evidence of patient leaking, or any evidence of biochemical imbalance, maksudnya biochemical changes lah, maksudnya high hematocrit, high lactate, non-resolving dan sebagainya. So you would put that into the category of critical phase. But tak pernah lah pula. I've never defined it as critical phase because there's sudden drop of temperature. Tak. I've never put. I don't think I've ever heard it done that way. Okay. Tu satu. Now the importance of being able to calculate the BMI about the fluid. The important thing is that you're not calculating just the BMI. You're actually calculating patient punya ideal body weight. So you actually would do this if the patient is overweight. Okay, if the patient is normal weight, there is actually no need for you to be calculating the patient's BMI. So you just use the patient's own weight as um as the weight lah that you use to calculate the fluid. So it's either 1 cc per kilo per hour, 2 cc per kilo per hour. That kilo per hour is using the patient's own weight. Kalau patient tu normal weight. But if somebody who's overweight or obese, then yes, you would need to calculate for the adjusted body weight. So what is the formula for adjusted body weight? Hello?
Yes, doctor.
Yeah. Okay, so what's the formula for adjusted body weight?
It is ideal body weight plus 0.4.
Yeah.
Then in parentheses,
Okay.
the actual weight minus the ideal body weight.
Yeah. Okay. So that's what you need to know. You need to be able to adjust to the patient's adjusted body weight. Um, and then now when you are monitoring for the patient's urine output, because I think you need to monitor it and make sure it's within 0.5 cc per kilo per hour kan in critical phase. You need to keep the urine output at minimum 0.5 cc per kilo per hour. So that kilo, what weight would you use? You know what I mean? Faham tak?
Um, I think that one we can
Hmm.
use the ideal body weight.
No, you would use the patient's own weight.
Sorry,
Because if you
measured weight.
imagine, the actual body weight, the actual body weight. So if you imagine somebody is 100 kilogram, 100 kilogram, and then you adjust the body weight, it's become 78 or 80, 80 kilo adjusted body weight. So okay, the fluid, the purpose why you actually adjust the body weight, because you do not want to overload the patient. Okay, that's the main reason. So you do not want to overload the patient. So now, if you are calculating the urine output, so if you use the ideal body weight or the adjusted body weight, then you wouldn't match to the patient's own size. Get me? So if the patient is 100 kilo, but you're only giving, maintaining the urine output of 40 cc per kilo per hour because of the adjusted body weight, kan? Then the patient can be under, um, apa, fluid resusc is a bit apa, not done properly lah. Boleh so that's the main things as to why you calculate the weight. So you're calculating the adjusted body weight for the fluids to give, and then you would use the patient's own weight to manage the urine output. So I suppose if there's no other take home message, that would be the most important one for you to take home, because apa that's your job, that's what you'd have to do as housemaids, that would be the main things that you need to know. um So you need to be able to recognize that patient is in shock. Now, jarang lah. I don't think we've defined them in dengue shock syndrome or dengue hemorrhagic shock anymore. I think the main definition is you would say dengue fever in which phase, and is there evidence of warning sign, and what are the difficulties. So you would say this patient is have dengue fever, day 5 of illness, febrile phase, with warning sign, in view of diarrhea and whatever lah, dehydration or acute hepatitis, and then or whether or not the patient is in shock. So um itulah, so we've never anymore we haven't really defined patients by having hemorrhagic shock or apa dengue shock syndrome anymore. We have not used that definition. I think that's an old definition actually. Okay. So, but it's very important to know exactly what phase the patient is on. So whether or not if it's defervescent, I would want to know how many hours is the patient defervescent. Yeah. Um, so that would be the key thing that you must identify. When exactly have you decided that this critical phase is? Okay, and then that's that lah. Okay, dengue. You guys are pretty good at dengue, I presume, because you guys always club dengue patients. But managing dengue requires a bit more art than just kind of assuming you understand the whole thing lah. Susah lah the fluid management. I'm not expecting you to really know unless you've managed dengue yourself. But otherwise, to be able to recognize critical phase and to be able to recognize a patient is in trouble, that will be your main jobs. Okay.
Doctor,
Yeah.
okay, like this, because everything from the discussion I took from the CPG. So, this sudden rapid drop in temperature, are you saying it's like not relevant or what? I didn't
No,
understand.
of course it's relevant, but it's not a big deal. I mean, there is what does it mean by sudden drop? Because sometimes you give paracetamol. How would you decide sudden drop in temperature, I mean, it's not relevant, but it was normal just now and suddenly it's dropped, is it? I mean, at some point it's going to become normal anyway, kan?
But according like where like our specialists that were attached to in Banting, like he explained that like let's say one like today he had fever like for 38, 39 degree, and then the next time they check it's like the normal like 36.6 or 7, and so he said that could be uh
No,
a reason.
that is the phase where patient goes into critical phase lah. Betul lah tu. But I mean, um, okay lah, fair enough. Tapi maksudnya 39, memang pun temperature dia 39, 38.7 and then it becomes normal, 36.6, which is totally normal. Tapi memang pun at some point it will happen that way, faham ke? So I don't really understand what's the big deal of memang apyrexia lah, patient become apyrexia lah. Faham ke? Tak tahu, I don't know. Sudden drop in temperature, memang pun memang dia drop in temperature lah. Memang it become normal. Patient becomes apyrexia. But critical phase does not mean patient is critically unwell. Faham tak?
Faham.
It's just a phase that you are looking out that there's a possibility of complications happening.
Okay,
But
doctor.
that does not mean the patient must be in shock. Does not mean that the patient the patient must be categorized kena masuk ICU ke. It does not mean that. It just means that patient has gone into critical phase. Itu je.
Okay, doctor. Thank you.
Okay,
Doctor.
orang lain okay.
Sorry, doctor. This one for the investigation, right? The microscopic agglutination test, is that often done in the ward for to rule out leptospirosis, or like the one the specialist in Banting said BKMP times 3?
Usually I would just do lab to IgM, and then if that's positive, then I would do it with MAT.
Okay. Okay, doctor.
Tapi tak semualah patient dengue kalau dah NS1 positif that you would do MAT kan?
Yeah, true.
Tu yang tu kalau macam you dah really suspect lab tu, but maybe IgM tu tak positif ke, you not sure, then you definitely do MAT lah.
Okay, doctor. Thank you.
Okay.
Doctor,
Hmm.
these days I realized that when they were, how to say, giving fluid therapy to patients, they will always, how to say, not say always, but they do check the the inferior vena cava for the Campbell
Yeah.
index. Should that be
Yeah.
routinely done, or is it like an optional kind of thing?
Maksudnya when I suppose they are practicing their echo echo skills lah when they're doing it. That's one. Yes, because when you're managing fluid, you want to be sure that you are not overloading patient, and hence you would check the IVC lah. So kalau lah IVC dia memang tinggi, then kita kata macam mana tapi dia still a bit you thought the BP is a bit low, kan, then you would definitely check the IVC to make sure you're not overloading the patient, because sometimes you need nak put low BP lowish tapi IVC dia elevated, so then you would actually sit on your hands and not do giving fluid too much. But banyak je sign lain, tak semestinya kena buat echo and apa checking, um, you check the pulse, you check the CRT kan, and then you do other things as well, not just checking the IVC lah. Yeah, but it can be routinely done if need be. Bukan rutin lah, just in I would do it in special cases, especially if patient in ICU and I think I'm not sure about managing the fluids. That's when I would do it.
Alright, doctor, understood.
I'm only hearing from the two of you. Is anybody else? Yang mendengar ni susah sikit nak dengar Macam faham ke? Okay ke? Ke boring sebab topik dengue?
Faham, doktor.
Dengar, doktor.
Faham So yang penting know the difference bila nak calculate for the ideal body weight ataupun adjusted body weight, because there are times that I've seen people adjust the body weight even when the patient is underweight, so which I think is a sin lah. So you shouldn't be adjusting body weights when patient is underweight or when patient is normal weight so you only adjust when patient is overweight. So that need to be kept in mind lah.
Right, doctor. I think ideal body weight, we also need to know the calculation, right?
Yeah.
Ideal body weight.
Yeah. So you do need to calculate for the ideal body weight. Tapi what you're trying to achieve is not the ideal body weight. You're trying to get it the adjusted body weight. Kan?
Yeah.
So dia dah tengok kalau ideal body weight dia dah ideal, tak payahlah calculate lagi adjusted body weight tu, kan? But you should be able to see if somebody is obese or not, right?
Yeah, definitely.
Yeah. Okay. Dah makan dah semua orang? Have you eaten?
Yes, doctor.
Okay. So, okay. I forgot to mention on Monday. One, I know the posting can be quite exhausting. There seem to be classes at all hours, like now, and start early in the morning with the travel and everything. It is quite tiring. So, my advice is to always make sure you're well hydrated, eat on time, and please sleep early. Macam lepas ni, you just pack up and sleep and go to bed. I always make the opportunity when I sleep, you do a little bit of prayer lah, hoping that your brain organizes all the facts that you've learned during the day. So, which I think works because, by the morning, I would wake up early, maybe about 4:30, and then I would do a bit of reading. Then it'll be quite fresh and you'll be able to learn a bit more. And make sure you have your own study group. You cannot do this without study groups. It's difficult to learn medicine on your own because there's just too much to read. There's just too much to read on your own. So make sure you divide and conquer. Because I think most of you would have a study group. Kepada siapa yang tak ada lagi study group, make sure you get a study group. Join je lah sesiapa. I know there are times that you feel maybe I'm the stupidest in the group. I'm not really all that smart. Everybody seems to know everything, but actually everybody is the same. It seems that your friends seem to know more, but that happens all the time. I don't know why. Happen to me too, happen to everybody. I think you always feel that way, and then sometimes you feel a bit threatened and you feel down because why is it I don't know why everybody seem to know everything. Tapi that's just normal lah but make sure you have your own study group and have good rest at night so that you'll be fresh in the morning. Your best time to learn is actually when you are in the wards. So kalau kalau you're too tired, make sure you sleep lah. No, there's no point staying up because you find yourself reading the same paragraph over and over. Um, so tu je lah kot. So if you find yourself tired, go to bed. Okay?
Doctor, one more thing. For common
Mm.
session, our topic is HIV, right?
Yeah, I think so. I think that's what they picked, isn't it?
I was told it's HIV, lah, but
Yeah.
so you got one HIV case, but is there anything that we need to like highlight in particular for the day?
I suppose the most important thing is the diagnosis and when you actually start treatment lah. Because you don't start everybody treating HIV all at once. Maksudnya tak adalah diagnose HIV terus treat. That's not the way you do it. So make sure you know the definition. HIV, it's defining illness. So when do you actually start treating them? And then complications of HIV, how they present with different presentations, and then the treatment. I think your seniors used to go really detail of the treatment, the different groups of antivirals, and how which group you start with which I think is a bit is a lot, but you can try if you want, but try to make it interesting lah, rather than I don't want you guys to be bored listening to it. I want to make it if you know how some common sessions are, even sessions like this, that some of you be listening and some of you won't even be listening. So try to make it
Interactive.
into a topic that people are actually interested to listen to. So that's why I decided against acute coronary syndrome or MI, or because you've done it in your PMS, and you've done it, I think, many years. That's all you've been discussing. So there's no point to go through MI again, because I think you're quite good at it. But pick a topic yang you don't always see the patients. So something that you can actually discuss and learn something new lah. Boleh?
Boleh.
Okay. Okay, guys. If nothing else, I might see some of you tomorrow. For